So please go ahead.
Okay.
Thanks, Sandra. I will just introduce the team. We'll move on to our next demonstration, which is a walkthrough of an ambulatory patient clinic visit led by Catherine Brazeau and Carolyn Carey. Ladies?
Thank you. Good morning. I'm Catherine Brazo, and I'm part of the patient access team. I'll be playing the role of an ambulatory outpatient clerk and in register. Okay, you can see, everybody can see the screen. All right, perfect. All right, here we go. So as you can see, there is a ton of functionality in the front office scheduler's desktop. However, for the purpose of this demo, I'll be giving you a quick glance at the orthopedic clinic's grid and perform a basic registration. So this is the ortho clinic ambulatory in North Bay, and it's just in the test system, obviously. And these are the surgeons in the clinic, and these are their schedules. So at a glance, you can see that there's everybody's patients that are in here, and they are scheduled, and some are registered. And you can also include some patients for the surgery, depending on how the setup is. So I'm going to stick with Dr. Creech. And you can see there's some little red or green dots and red dots, and this represents the registration. If they're registered, they are green. If they have surpassed their scheduling time, it turns red. Doesn't mean that you can't register the patient, but it just gives you a quick view of, somebody that hasn't showed up yet, or they're going to go to no-show at the midnight run if they have not presented. I won't go over all of the functionality above here because just in the to keep everything in the time constraint here, we will just go to a scheduled patient and register them. So we're going to be doing a Carolyn Am test here, and I could click on the double arrow and it'll give you more information. The appointment, the patient's account number, the reason for visit, their status, age, date of birth, telephone number, the surgeon, and the clinic that they're in. All right. And if I left click, I can go and check them in. You can get more information on this tab here, their health card number, their MRN. There are a couple of ways to register a patient, but I'm going to do it via the grid. I can go to patient summary and bring up the patient, and then you can view all of their other appointments that they had in the past or in the future. So from this screen here, I can check them in, I can edit the visit record, I can change their status, or I can view. So I'm just going to go directly to check-in. And this brings you directly to if there's any special indicators on the patient. You will have a quick view of this. Just going to hide this button here. Now, you will follow the script by your facility or the clinic and ask the appropriate questions. If there's any required fields that need to be filled out is where you will do it. So I am going to just, I would ask the patient who their family provider is and change it if necessary. I can scroll down and check off if there's any labels or forms that need to be printed once I check them in. You can say how many copies you need and what printer it would print to. On the right-hand side here, you have all the little folders kind of thing, comments, if you need to edit them, the special indicators, the appointment details, their demographics. You can review that and change and edit them if necessary. Their health card number and their insurance would be in the insurance tab. The portal tab we're not using right now, pharmacy tab, their contacts, guarantor, visit history, financial tab, and care team. These can all be edited. All right, so is there a question? It will print does this mean it could be available on multiple printers? This currently doesn't happen in Meditech. So it depends on the setup. So the clinics can have access to all of the printers within your facility or just to certain printers within the clinic. So I am going to click on check-in, and at this point it'll bring you to any required fields, or if there's any queries or CDSs, custom defined screens that need to be filled out, you will fill that out at this point. On the left hand side, anything that appears in red is the required fields are missing values that need to be filled out, and you'd be able, if there was anything like other than the demographics, because it'll bring you right to the page that needs to be filled out, you could click on any of the other tabs that need to be that are required. So at this point here, this is a custom defined screen, and it's asking me, do you consent to automatic reports from this visit be sent to your family provider? And you can answer yes or no, or whatever the patient is going to answer. And it's asking me to verify the defaulted family provider is correct. And I did that in the previous screen. Here it is asking me if demographics and family provider has been verified, and I would answer yes or no. And then my name would populate to say that I am the one that verified it. So if there's any other tabs that need to be filled out, you would fill that out at this point. You can always go back to any of the tabs and change the information. If you scroll up, it brings you to the previous tabs. It's all in one screen kind of thing. So you can access it from the left or go to the tabs on the right. At this point here, I am going to click Save. It's asking me if I need to review any orders. I have no orders that I have attached to this appointment, so I'm going to click No. And again, it gives you a chance to review and change anything before you confirm and click the check-in. And then you will see that the little button here turns green. Okay. Well, that was pretty quick. Is there anything somebody wants me to go over? I know that we're pressed for time and Carolyn needs to go over all the clinical side. So, what happens if you click no for verifying PCP? So we don't use PCP. It's actually the family provider that we use. PCP is it's an American standard. And if you click no, it depends on how you have your rules set up. It will just ask you to confirm or to change some fields if necessary.
Carolyn, I think you're on mute.
Yes, it verifies the health card number. I cannot verify the health card number in TESS as we are not attached to, not connected to the Ministry of Health.
So let's move on just in the interest of time. You could answer the questions in the chat if there's any more. Carolyn, I'll hand it over to you for the next portion.
Okay, thanks. Can you see my screen?
Yes.
Yes.
Thank you. Okay, my name is Carolyn, and yes, I'm going to play the role of the nurse or the ortho tech that's working in this clinic. We're going to demo a first consult for a patient coming to the orthopedic clinic today. Excuse me, is there a question? Okay, I'm going to launch right from the menu button. And as you can see, we go from ambulatory to the clinical home screen. Once I go in here, I launch right into the schedule for today. So basically, this is my orthopedic schedule today. And as Catherine said, we're working out at the North Bay site today. So I'll just do a quick little overview of what I see. So basically, we have 9 patients booked today, and we have a surgical case on our schedule as well. So basically, you see all the times of the appointments here. You see all the patients, and you can also see why these patients are coming in today, which is really helpful. And over here, we can see the doctor that's associated with this patient visit, Dr. Creech, we have Dr. Wallace, we have different doctors. And basically here, this shows the status of the patient. So this patient's doing an intake, and this is some different statuses that we can change. Not all sites use this, but I think it's pretty handy. This patient's in a book status, so that means they have not arrived yet. And we have some that have arrived, are sitting here waiting, so that this is a really good indicator. Here you'll see some little icons. So this one means that there's a pending x-ray on this patient that's waiting to cross. And this one means we have some office procedures, which means there's some documentation to do on this patient. And I'll show you that as we go into the patient's chart. Here you can see, just shows me if there's documentation that is required or pending on this patient. So this is telling me that there's a document open on this patient, and I'll explain that as we go into the chart. This patient, it's all signed off. This one's good to go, and nothing's been started documenting on this patient at this time. And basically over here, I think Krista already touched on this. This is our recently assessed patients, access patients, and they sit here for like 14 days and then they fall off. So I'm going to go right into my patient today. So basically when I come right in from the chart, I come right into the chart. Not going to get into this because Krista did all of this today. So we have the chart view. We can go into document. Is there something else? And then we go into the order piece. Okay, so basically you can see here, I have some documents that's sitting here. So basically in these clinics, we have built templates for all of our clinics. I left a few here today just for you to see, because normally what we tell our staff is to favorite their documents if they're working in a specific clinic. And the reason for that is, if I show you this, you'll see this is an example of, and this is just our test system. This is an example of all the clinic templates that we have built so far for all of our clinics. So it's pretty intensive. And this is just the clinical documents. The physicians have a different view. So basically, like I said, we usually say, just favorite your documents because it's pretty overwhelming. So I'm just going to delete this document and start over just so I can give you a clean one. Yeah. Okay, so basically I just favored a few just so you had an idea of what that looked like. So basically I'm going to go into my orthopedic clinic visit template. So my patient has arrived and I'm bringing this patient in to the clinical area to do an assessment. So basically what we've done with all of our outpatient templates is we've built into these templates all the documentation that is required for these clinics. You can always add more documentation to these, but we've tried to compile it so that everything is here and easily accessible so that the staff doesn't have to go and find more documentation. So basically you can see here, they're all classed, but if you open them, there's much more documentation included in these. So this is visit type, vital signs, etc. I'm not going to do all these today because of our time restraints. And as you can see, I can do this, I can access these from here, or I can also access them from up here as well. Okay, so basically today I'm going to do a quick little quick intake on this patient. So basically I have my patient in, and I'm going to start my visit type. So this is their initial visit, and here's the patient, and there's some family with them, and they're in person. So like I said, I'm not going to do all of this. I am going to throw in a quick set of vital signs just so you can see what it looks like. And respiratory rate. Just really quickly, just so you know, it's pretty fast. And then I'm just going to go over here and quickly look at my patient's chart. I'm going to look at the allergies, just make sure that they don't have any allergies. I'm going to go in. I'm going to confirm with this patient, is this your allergies? And they confirm that nothing has changed. So I'm going to confirm all these allergies and save them. I'm also going to quickly go into the medication list and make sure that their home meds are all accounted for. So I'm basically going to go in here, select reconcile, going to go in and look at the patient's home meds that they're taking. I'm just going to make sure all of these meds are correct. If they weren't correct, I can change them, I can stop them, I can search for new meds. For this demo, I'm just going to say, nope, they're all correct. So I'm going to confirm these, and I'm going to save them. Okay, so I'm going to go back. I can have a quick look at other things here if I wanted to, like their past medical history and things like that. And you'll see as soon as I documented the vitals, they went right over to the chart. Okay, so I'm going to go back to my document. Looks like Catherine's in my screen, that's fine. So as you can see, so now my visit, so I haven't signed off on my note yet because I'm not finished. But as you can see, it's now sitting up here. It's sort of hovering. So basically, when I go back in here, I can click on here. So these are multi-contributor screens, and I think there were some questions in the chat about this. So what this means is, yes, multiple users can contribute in these documents. So basically, if I got pulled away and someone needed to come in to take over, as soon as they touch this document, they will become a contributor. I will be the principal because I was the first person that was in this document. I can also change the time here. If they were a little behind on their documentation, they can come in and change the time as well. And then I can go back up here and I can go back into my document. Okay, so basically now I've sort of done my intake. I'm just waiting for the doctor. So the doctor now has went and seen the patient, and he's told me that we need to put a cast on this patient. So I'm going to go and enter an order for this cast. So I'm going to go in to my orders. I'm going to turn off some of these pop-ups. Okay, I'm going to go into my orders, and I'm going to go and order a cast. So basically, I can go up here and I can order any orders that I want to do. I can go up here, I can do cast, I can do whatever. But what I have done also is down here, same as our documents, you can create favorites in your orders. So if you're working in a clinic or an area where you're constantly picking the same orders, you can favorite them. So all I would do, which I have done, is like I said, I would go into cast, and as you can see, if I put a little highlight the star, it makes it yellow, then it makes favorites. So that's really handy in these clinics. So basically, I'm going to go down here to my casting order, and I'm going to do a cast application, and I'm going to say it's a verbal order from Dr. Creech. And just so you know, it's not normal that the nursing staff put in these orders, but for the demo today, I will do it. Normally the physicians put in their own orders. Okay, so basically this order is here. I just gotta find it because my list is so big. Where's my cast order? Where's the order? Okay, I've lost my order. This again. Sorry about that. Oh, wait. Well, I'm not sure why. I've done this order a million times. Anyway, from the orders team want to help me out. Do you see my order? I've done this so many times. I don't see my cast order. It's not going. I'm not sure why it's not going. Sorry about that. Okay. I'm not sure why it's not going. And okay, so I'm going to go back to my visit. Go into my patient. I'm getting all these pop-ups today, of course. Okay, so now I'm going to go and finish some documentation on this patient. I'm going to pretend I put in my order, even though I'm not sure why it's not showing because it was working perfectly today. Sorry about that. But I will go in. I can also go in and I'm going to say that I did some ortho education today. I put on I did some cast care. And if there was other documentation that was required on this patient, I can do it here. And not everything is required when you see this template, as you can see. So basically, only what flows over the chart is what we've documented on the patient. So we've added in here like the PT, because some ortho clinics actually have PTs associated with them. They don't all have them. And some ortho clinics have ortho technicians, some have nurses. So we've left it all here so that it's readily available for them. So now I'm going to go in and do my clinic departure. So basically the patient is getting ready to go home. So I can put in now that they're leaving now. They were ambulatory and they were with their spouse, and I did give them some education and they're going to follow up. So now I'm going to go and sign my note. So basically, it will take a minute, and then while I'm waiting for that to cross over to the chart, what I'll do is I'm just going to mention this shows here that I have 6 documents in my queue that needs to be signed. Usually what we train staff is when they're done at the end of their shift, it should be down to 0. We shouldn't have anything hanging unless there's some multi-contributor documents that takes more than a day to complete. So I would just sign them off here. So I'm just going to go back in and see if my note has crossed yet. And let's go see. Must be the clinic pen for you. I think this should be the one. So then you can see everything that we've documented today. Okay. Any questions about anything else? I don't know. Catherine, did you want to show? So the doctor wants this patient to come back in a couple weeks to get a x-ray. And so, Catherine, if you want to demo that.
Yeah, do we have enough time to demo this?
I think we do.
We do. Go ahead, Catherine.
As I said earlier, there's multiple ways to register a patient, to schedule a patient, and to find a patient on the grid or in the MPI. So I am going to reschedule this patient by going to the patient summary and finding the patient by a search. You can put in the last name, first name, but what we recommend is always to search by health card number or account. So I'm going to, because I don't have the health card number here, I'm just going to put in the last name, first name, and do a search. And this is if there was multiple patients with the last name or the beginning of, like with test, they would all appear here. You could click on the little I information icon here to get more information, and you would get their MRN number, their health card number, their address, telephone number, etc. And if that's the patient that you would want to select, you select the patient here at the bottom. And this brings you into the patient summary. And as I explained earlier, you could see any appointments that have been registered, scheduled in the past and in the future and currently. I am going to go and click on book here. I just wanted to show you that on the right hand side here, you have the patient data, and this is at the MRN level, and the visit data is at the visit level. So whatever you have highlighted on the left hand side, you can have all the information for that visit. So I am just going to click on book because I want to schedule a new appointment for this patient. And I'm going to, you see that any of the recurring accounts will populate, and you can select those if it's a recurring account. But for this one, it's a clinical account, so I'm going to select a new account. The special indicators will appear if there's any. And I am going to select the new appointment. It's an orthopedic with x-ray, an orthopedic clinic with x-ray through the cast, and that's going to be the next appointment. And as you can see, all the location, the duration, and reg type populates. The visit reason, you have to manually put that in. It is free text. I'm just going to put x-ray follow-up. The date and time. So the doctor left a little note for me, and he wants to have a follow-up appointment for this patient in 2 weeks. So I can do T plus 14 days. I can do a search and see what's available, or I can put in a time and it'll automatically populate. So I'm going to click on the details here and assign this appointment to the resource. Right now, they're all surgeons, and I'm going to assign this to Dr. Creech. I can select here and put Dr. Creech in because that is who saw the patient and who wants to have a follow-up appointment. So if there's any queries or CDSs that are mandatory, you would fill in at this point here. The diagnoses, I'm going to just put not applicable because the clerks wouldn't know what to put in there. If it's a surgical procedure, yes or no, these are the two mandatory fields that need to be filled out because they have asterisks beside them, and it is not a surgical procedure. And I will just book schedule here. If there was anything else that needed to be filled out, I would fill that out. As you can see, it populates at the top, and you can see that it's booked and for what time and the date. And this is highlighted now, so all the information for the visit will populate on the right-hand side. If you need to edit this, if you made a mistake with the appointment, or if you need to change anything, add comments or anything like that, you would just click on the edit on the right-hand side. Okay, so that is pretty much what I have to do.
Kat, there's a couple of questions, and just let me know if you've already answered them. How does it know that the provider is available?
Okay, so there's multiple ways to do that. So we could have done a search, or they can have another screen open. So if right now, whatever I have highlighted on the left-hand side, I can go directly to the grid. And then you would see if there's any availability. You could also have this screen open on another monitor. And then you can do a search and it'll bring up any availability and you would select from there. So there's multiple ways to schedule an appointment, depending on the clerks, what they prefer, their preferences.
Thanks, Kat. Next question. Is that note from the provider to book the follow-up in the record somewhere? So the doctor has asked you to book them to come back. Is that note in the chart, or how do you get that note?
I think some of the ortho clinics still print off a piece of paper and they write it on there and they give it to the clerk. And that's how the clerk also puts in the follow-up orders as well. And then it's scanned into the chart.
Next question, is that surgical procedure question a standard part of the appointment, or is that a custom question that the Northeast has added?
So that is a question for North Bay, and for like if there's wait times or anything like that that needs to be involved with the appointment, they would put something similar to that in there, but it is facility or clinic specific.
Next question, will demo recall propagate to recurring accounts, i.e. update the family provider? Does this update recurring accounts?
Okay, so that's a good question. Most facilities have demo recall for the family provider. I think we have a couple that don't. So it will populate for any future appointments. You will have the family provider that will populate for those that have the demo recall.
Thanks, Kat. And I'm just going back. There was a question earlier when you were able to select what you wanted printed. The question is, you mentioned which printer it will print to. Does this mean it could be available on multiple printers? This currently doesn't happen in Meditech client server. So I guess, could you print to different printers?
Yes, depending on what the person has access to. So that is all access driven. And if they have access to multiple printers, I mean, you'd have to do it like if you're printing a face sheet or a registration package or something like that, you'd have to select the printer, one printer at a time kind of thing. If that makes sense.
Kat, sorry, it's Julie. So I guess I think the concern about the demo recall and propagating to recurring accounts is there was an issue in client server that unless you put the change on the patient's original account, it wouldn't propagate anything forward. The propagation only occurred backwards. Do you know if that issue still exists in Expanse?
So you're saying that like if it's not on the original appointment when it's recurring, so
Right.
they can change it. There's a different process for recurring, and there's several processes for recurring actually, and they can use the revisit functionality, and that would be changed per visit. But you're right, it was causing issues back then. Yeah. Yeah, but usually it keeps the original, and then you'd have to change it per visit.
Kat, I'm not sure if you answered this question. It was, can we attach orders to appointment types without having to pre-register them?
So that's a great question. I will do that right now, actually. Am I still sharing my screen?
Yes, you are.
Okay, so we need an x-ray for this patient. And if I go into the chart, and this is as a clerk, and I need to have an x-ray done for this patient for the future, I would click on home medication list. This is like a workaround because we don't have access to the ordering tab up above because it's a clerk access. We click on the home medication list and it brings you directly to the orders tab. And at this point here, I could put in the order, which is a RAD, and you could also save them, as Carolyn explained earlier, by highlighting the little star here. And if I needed to do an x-ray for the right foot, depending on what the doctor ordered, I would click on that, and then it would be considered a written order, and I'll save that. And this is actually in a scheduled appointment. And then I would go to the order and make any changes necessary in there. So the location will be medical imaging, and the service date will be for the 2 weeks from today. Any relevant history would be in, you'd have to put in here, but we always tell them to put not applicable, because the clerk wouldn't know what to write in there. And then if I save that, then you'd have the order summary that populates, and you save it. And now you have an order that is attached to this patient. Mm-hmm.
Again, that's a workaround because, sorry, can you hear me? What you just there, where the clerk is entering that order. Again, is that the physician was not able to enter it for some reason? Like, is it usually the physician that would be entering that order for them to come back and have that x-ray?
For that, Catherine?
Go ahead.
Do you want me to answer that question?
Yes, please.
Usually for the follow-up orders, and again, it's very specific on the clinics and the workflow, because the workflow is not the same at all orthopedic clinics. Usually the workflow for a patient returning is the clerks will put in those orders, and that's why he writes it on a piece of paper for them, because they can't take a verbal order. So he does write it on a piece of paper and hands it to a clerk. But like I said, not all sites or not all clinics do that, but that is a typical workflow.
Okay, so in that case, you could have a physician that is entering that order.
Absolutely.
Yes,
okay. Absolutely.
Sandra, I just wanted to do a time check. We do have a few more questions. Should we continue or wrap it up?
Are they very specific questions, or maybe we'll go till 10 after? So maybe we'll take the last two questions. We've got Lillian and Sari, and then we'll cut it off maybe.
Okay. So Lillian's question is, currently lab cannot see blood work ordered for the next day in Meditech. Will this change with Expanse?
I don't think we have anybody from lab on the call, Maria, so I don't know if anybody knows the answer to that.
Julie, I can only speak to the midnight run. And so everything from OM crosses on the midnight run into the lab from an orders perspective. So essentially an order for tomorrow doesn't exist in the lab module until it crosses out of order entry on the midnight run.
Yeah, sorry, it's Lil here. That's a disconnect with us, just because the nurses will call and say, you know, they've ordered it for tomorrow, but we can't see the order, so we can't assist them if they need assist. That's why I was hoping Meditech would fix that for us.
Midnight run still exists. In the ambulatory module, there's a hold queue that's created that I believe you can see prior to.
Yes, that's correct.
In ambulatory only, though.
Yeah, they'd be sitting in the whole queue, and you could see them.
At the Oilers.
All right, I'll talk to Amanda about that too as well. She's our person. Just curious, because thank you.
Okay, and our last question, can the order entry access not be added to the clerk's profile at the user account level? So I'm not sure if that question is, can we restrict the clerk's access?
Yeah, so like Carolyn mentioned, currently in several of the outpatient areas, just due to the flow of the clinics, sites have chosen to allow their clerks to assist in entering orders, but only very specific orders, such as lab and DI, not medications, not nursing care orders, but just those lab and DI orders, just so they can get the flow through the department. They also allow them to enter referrals. So if there's a referral from one mental health clinic to another mental health clinic, they're provided access to enter those orders. So yes, it is controlled at the access level, and no site, per the regional policy, allows inpatient clerks to enter any order. So those have to be entered either by the physician, and if the physician is unable to, by another registered staff, such as pharmacy or nursing.
Thanks, Julie. That was the last question. Did you want to wrap it up, or did you want me to, Sandra?
Well, yeah, I could just say thank you very much to everyone who presented today, and all of those who were answering questions in the chat. It was really some great questions, and obviously lots of interest in these in the modules and what's possible with Expanse. So thank you all for your expertise. Just wanting to highlight that we have our next one tomorrow at 1 p.m. Eastern time. It's related to an emergency room visit. So if you're interested in that, please come back. It's the same WebEx link, so you can just use the same link tomorrow. And then, of course, Thursday morning, we have more of an acute care visit focus there. So thank you very much. We will have these sessions available if you would like a recording, and they will be available eventually more broadly to staff once we come up with a way to make that accessible to people. So thank you again.
Could you actually resend the link, because I got connected to the wrong link and it took a while to try and figure out how to copy and paste that from the link I was using to get onto the new site?
Yes, absolutely, Dr. Lane. I will send this link to you directly.
Thanks so much.
Thank you.
Okay, bye-bye.
Thanks, everyone.